Good morning, actually. Good morning. It's before noon today. Today is Wednesday, the 20th of January, 2021, and this is the English language summary of the daily press briefing here at the CCSA. So just now we had the assistant spokesperson, Dr. Apisamai, Dr. Bird Apisamai, who is a psychiatrist, as assistant spokesperson, summarizing to us the important information and situation for today. I'd just like to start off by saying that, of course, all the friends, all the countries, friends of Thailand around the world, the governments, the people, society, we're all looking forward to returning life back to normal, hopefully by this year or so. And of course, life continues. And in some of our in some countries, our friends around the world, some countries are having changes in administration. They're strengthening their governance and also social development. They're consolidating the strength of their society. Sometimes a change of government after an election and all of that. But nevertheless, even though life goes on, the governance, all the administrative duties go on, we still are mindful of the common threat that we have, the common challenge that we have in the name of COVID. So best of luck, of course, to all of our friends and allies and all the countries around the world that are facing this situation together, as is Thailand. So starting off first with the general situation and the number of cases that we recorded for today in Thailand. Today we have active cases totaling up to 2,961. 2,961 currently in treatment for COVID, and we have new confirmed case as in the number of 59. Out of that number, 28 are from local transmissions, 23 from active case finding, and 8 cases from state quarantine. The cumulative number since last year is now 12,653. Total cumulative recoveries, 9,621. There is unfortunately, one additional fatality, making the cumulative number since the beginning as 71 deaths. This 71st case is a 48-year-old Thai female from Tak province. Actually, the first case found in Tak province is this person, and her profession is that she drives and transports migrant labor in the Tak province area. So our condolences to the family of the lady who passed away. Some observations from the assistant spokesperson's briefing just now. Right now we have 62 provinces that have been included in the number of provinces reporting to have infections in Thailand. The most recent province being Nakhon Phanom. So therefore there remains 15 provinces without any case of COVID at all. And this 62nd province is Nakhon Phanom. The background of that is actually the person who is from Nakhon Phanom who got infected actually came from Bangkok. The person traveled from Bangkok back to visit family in Nakhon Phanom, and it was an asymptomatic case. That's why it is kind of very important for us to stress again about us not being too complacent, about the risk area. So one highlight is that usually what happens now is that people tend to be complacent after they visit risk areas, which is very, very risky and very, very, very dangerous. So if you know that you visited any risk area or had any risky behavior, please don't be complacent. Please keep in mind that what you can do to help society is very important. You can do home quarantine first, and then if there are any symptoms, you can of course see the medical facilities. So that's very important, not to be complacent after we have information or we realize that we've visited risk areas. So being complacent after visiting risk areas and being COVID being asymptomatic, that's a very I would say, lethal combination. Because as Dr. Apisamai explained in the Thai edition just now, that when people are complacent and plus the asymptomatic nature of COVID, it might affect people in the nearby cluster, in your workplace, in your homes and the like. But if that goes unchecked, if there are no actions taken, at least in terms of home quarantine, work at home, if there are no actions taken, most likely the first cluster of infection, which is your people close to you at home and in their office, most likely the first cluster will infect a secondary cluster, a second cluster. And the second cluster will, in due time, infect a third cluster in your city or in your society. So it's very important to stress this because of the asymptomatic nature of COVID. And from the statistics that we have, most of the cases in Thailand are asymptomatic. So just to move on to some important issues that might be useful for the English language audience. One is about the field hospitals to be built, more to be built in Samut Sakhon. Good news for those living in the area. The Federation of Thai Industries, or FTI, and its partners are surveying more locations to construct another field hospital as an effort to help cope with the outbreak in Samut Sakhon. That's the source epicenter of our new wave, this current cluster. The new field hospital will have a total capacity of 200 beds, and construction will begin immediately once the proposal is approved by the authorities and the community in the vicinity. A large group of migrant workers who reside in Samut Sakhon province, many of whom have contracted COVID virus. This is to cater to that need. The establishment of these hospitals will help provide adequate access to health care for these workers, while at the same time help contain and slow down the infections in affected areas as infections are isolated from the rest of the community. Another interesting information is about the Office of Insurance Commission, or OIC, extending measures to help insurers and insurance businesses from COVID. They have extended these measures introduced last year to be effective until the 31st of June 2021, helping insurers and insurance businesses survive during this outbreak. These measures include allowing insurers to delay the insurance payment for 60 days, allowing casualty insurance premium to be paid in installments, and allowing car insurance premium to be paid in daily or monthly basis. Another topic is on the Department of Employment, Ministry of Labor, issuing guidelines for migrant worker registration. The department recently introduced guidelines for foreign workers with or without employers from 3 nationalities, Cambodia, Lao PDR, and Myanmar, on how they can register for work permits and pink cards. The foreign workers from these 3 countries are required to register personal information online at eworkpermit.doe.go.th between the 15th of January to the 13th of February 2021. Also required to undergo medical checkups and COVID screening by April this year. And after receiving the health certificate, these foreign workers are then required to apply for the work permit at the same website, the eworkpermit.doe.go.th, within June 2021. And of course, for employers, you can find information on this at the Department of Information's website and hotline, which is 1506. So, although we have a new number of infections greatly lowered today, it doesn't mean that our active case finding efforts are lower. Active case finding is actually done around the country, not only in Samut Sakhon, in various provinces around the country, which is very important. And that, of course, comes to light the importance of our medical personnel who are providing, and those staff who are providing active case finding in very crucial areas in many provinces. Dr. Pisamai mentioned that they too, medical personnel and those who are conducting active case finding are themselves at risk and perhaps victims as well of this situation. So our hearts go to them. So therefore, we have to remain vigilant and cautious, and the race against COVID has yet to reach the finish line. And what we can do to help our medical personnel and those conducting active case finding around the country is that we must not let our guard down. And once again, to remind you of DMHTT, and this stands for distancing, mask wearing, hand washing, temperature check, and Thaichana Mochana applications. So as we continue to wait for the arrival and certifying the vaccines that we will be procuring and distributing, our best medicine, or the best medicine for the time being against the disease, against the infection, is of course mindfulness and precaution, and not to be complacent, and prudence in keeping ourselves safe. Because if we all work together and respect in our respective preventive measures, respecting the preventive measures, the guidelines, with or without vaccines, we will surely be able to contain any further outbreak. And that will be very, very helpful to containing the situation in Thailand. In general, I would say that the situation is getting a bit more stable. The numbers that we find each day are mostly from active case finding, less from local transmissions. If you recall last year, we had a number of days, around 100 days, with no local transmission. We were very happy about that. And after around 100 days plus, we found some cases of local transmission. Now for the new wave this year, it's kind of reverse. It's kind of less of local transmission, but more of cases from active case finding, which is very good, which is proof that our missions to go into various communities or hot spots to root out and identify positive cases is working. This mission is working. So very happy about that. So of course, just lastly, to extend our appreciation, still we constantly do this, to our medical personnel and those performing active case finding. And Dr. Pisamai, the assistant spokesperson, mentioned this at the end of her presentation. Very important for us to keep mindful of that, those groups of people who are doing this for us even up until today. So thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ